I will hand over the microphone now to Erin Flynn, or give the floor to Erin. She represents WaterAid. We'll be speaking on wash and nutrition integration. What can it mean in practice? And I really want to thank WaterAid also in the preparation of this event. Few words while this is being set up with the presentation to Erin. She's a research manager at WaterAid, currently managing a randomized controlled trial on household sanitation in Nigeria. Previously worked in Southeast Asia on malaria, migrant health, and child health, and has a background in public health and nursing. We're looking forward to your presentation.
Great.
Please.
Thank you. I'm going to share some of our experience in integrating WASH and nutrition in South Asia in the development context. For people that don't know WaterAid, we work in 29 countries in Asia and Africa, delivering WASH programs and advocacy activities. I'm going to mostly talk about the how, but I'll touch a little bit on the why and the what. So I think a lot of this has come up already in the last 2 days, but why integrate? So the programmatic links between prevention and cure have the potential for improved impacts. We've seen this in trachoma and other initiatives, or other diseases. I think Hannah mentioned this in her presentation, but poor nutrition and lack of WASH are likely to be a double burden faced by the poorest. So this is about reducing inequalities as well, and working towards SDG 10. We're under increasing pressure to deliver sustained impact and value for money, and there's a move away again from vertical approaches. And this last point, for the people we're trying to reach, I can't emphasize that enough, and I think this came up in the reflections this morning. But vertical programs create divides in the lives of people. Okay, so integration is one of WaterAid's key aims, one of our 4 aims in our new global strategy. And developing this strategy, we took a deeper look at what integration means. So we kind of broke it down into 3 areas, and I thought this would be useful to share today. So convergence. So I think yesterday is a really good example of us coming together and agreeing. Coordination. So this is about a common action or movement. And I think good examples of this are a joint planning and targeting at a national level, or joint monitoring, or global frameworks, so nutrition frameworks that recognise WASH. And then lastly, integration itself. So I think this is about bringing all the pieces together and making it whole. So this could be about joint delivery of initiatives, and this, I think, is the most person-centred approach. Okay. So which is best? And when is it the right thing to do? So while we think about this, I know Oliver presented a lot of evidence yesterday, but I thought this is a really striking graph. It's from a really old study in Guatemala. But you can see here we've got like linear growth of the children in the study up to 6 months of age. And this is because of really high adherence to 6 months of exclusive breastfeeding. But when complementary food and water start to be introduced, got high rates of diarrhea, and you can see, the growth curve. There's faltering in the growth curve, so the height's dropping down. So I think when we talk about where efforts need to be focused, this is a really critical time. Okay, so our experience. So what does it look like in practice? So I'm going to share 2 programs, one from Bangladesh and one from Nepal. So in Bangladesh, we're working with USAID and WASH Plus to work on a large-scale nutrition program in 4 sub-districts with really high rates of undernutrition. So this includes a large WASH component, which is about increasing access to safe water and safe disposal of child feces, plus other hygiene practices. Some outcomes that we've seen in this project are enhanced food production at the household level, access to safe water, increase in essential nutrition behaviours such as exclusive breastfeeding for 6 months, and hygiene, so hand hygiene. And I think just on this slide, something to flag is I think disposal of child faeces has been largely neglected in the WASH sector today, and something we need to take note of. So in Nepal, we're working with the Ministry, this is a new project, we're working with the Ministry of Population and Health to build hygiene promotion into routine immunisation. So mothers will attend immunisation clinics with their children less than about a year of age, and they also participate in hygiene sessions that promote exclusive breastfeeding, hand hygiene, food hygiene, safe disposal of faeces, and safe water management. This is delivered by the Extended Programme on Immunisation, so like trusted frontline health workers. And I think this is a really nice example for a number of reasons. So we've got really good targeting of children in that critical age group. We're targeting mothers with new babies who we know are receptive to these messages. It's based on interpersonal communication, which we know is important for changing kind of knowledge into practice. And we did a big piece of formative research to inform the design of the behaviour change intervention. So it's built around emotions such as nurture, affiliation, status. Okay. So finally, what's needed for better coordination? And I think, what's really nice about this is I've heard this a lot over the last 2 days, so I think there's a lot of agreement about kind of where we need to be focused. But planning, so kind of these are just ideas, but better use of national monitoring data for decision making. So I think the nutrition sector does this well in targeting areas with high rates of undernutrition, but we could do this in the WASH sector better. So we could look for areas with low WASH coverage and high rates of undernutrition. And it was really great to hear that the Burkina Faso WASH and nutrition strategy already recommends this. Investment. This doesn't necessarily mean more funding, but maybe smarter funding and thinking about process. So who's going to fund joint planning? Who's going to fund joint supervision? Who's going to fund behaviour change initiatives that aren't as cheap as we thought they were? So targets and indicators. We might need a change in the targets and indicators which performance is measured. So maybe nutrition programs need WASH indicators and vice versa. This could be done nationally within large donor programs. And this doesn't mean WASH specialists running around delivering nutrition programs. This is about incentives and nudges to build coordination and collaboration. And finally, evidence. So I was in the evidence group yesterday, and I think we agreed there was kind of enough evidence to act based on the links between WASH and stunting, maybe less on the wasting. But I think there are other reasons we should collaborate anyway. But maybe we need more evidence on effective integration. So what does the integration we're trying to do, does it really work? What is the minimum package of WASH and nutrition that, where do we have the biggest bang for our buck? And yeah, I think the stuff Oliver mentioned yesterday, there's some sanitation and hygiene issues that probably disproportionately affect children and the key age group we're trying to target that have been largely neglected by the sanitation sector. So yeah, management of child feces, food hygiene, and animal waste. That's it. Thank you.
Wow, thank you for being that concise.
Is that too fast?
No, it leaves more time for you to react to questions that may be coming from the floor. Josephine, yep. And we'll take any other hands. I would take a few hands at the same time.
Yeah, it's a very interesting and really useful presentation. Thank you so much. It actually reaffirms some of the things which came through yesterday. It's not a question, but basically, for me, I think it's a plea that, yes, the Cochrane review did focus on the link between WASH and stunting, but not necessarily wasting. But the truth is that when you look at the public health documentation that we have had over the years, the link between diarrhea, which is waterborne, water-related issues, and acute malnutrition is already established. We know that in camp setting, or even in a given community, seasonality, really where issues around WASH and so on, can trigger high levels of acute malnutrition. So for me, I think what we need to take away from this is that, yes, the reviews have not focused on that in terms of linking the evidence, but we know that there is that linkage, and we know that if there's better access to water and so on, then you can reduce some of the incidences that we see in acute malnutrition, and I really think that shouldn't be the reason for not doing something, because we're already doing something, and I really want us to kind of have that as a take-home message. Just quickly on the issue around linking sphere to, can I say that? Linking sphere to developmental, the indicators that Alam said, I think the difficulties we have here is the minimum standard. And in context where there's low acute malnutrition rate, but there's really a need in developmental setting, we cannot say that a child who is severely malnourished should not have access to treatment. It's a human rights issue. So in developmental setting, I think what we are saying is, regardless of whether you have reached that threshold, if there's indication and there's a need, then that child has to be treated or prevention has to be provided. And I think also this is something that we need to keep at the back of our mind. Thank you.
Okay, thank you for that statement. Other comments from the floor or questions? The microphone's coming around. Other hands? Okay, and then just behind you.
Yeah, a question on the two cases. How is because I think you have different partners in the two cases. How is it about ownership from the two sectors? So, because a lot of I think the more political economy issues around intersectoral work is sort of who can count this as his or her program. Have you experienced, how did you build that trust among the different actors? And what are your experiences in that sense?
Okay, and then Ben.
Yeah, hi, Erin. Thanks for the presentation. I'm just wondering, I really like your kind of description of the 4 areas where we need action, or sort of the sort of things to think about, and which of those would you say are most important out of the P, I, T, and E? Yeah.
Okay, if there are no other questions at present, please.
Yeah. So I think responding to the first point, I think I agree completely on the evidence. I think there are other reasons to act around kind of the issues of addressing inequality. And again, this issue of these vertical programs create divides in the lives of people, and often the burden is on mothers. For the kind of what the two sectors working together, how does it look? So the program in Nepal, I think, because we've worked so closely with the Ministry of Health, it's been great. And the delivery is actually done by the immunisation workers. However, at the district and national level, there's a multi-sectorial kind of decision-making groups, and that's new, but I think that's working really well. And I'm not sure about Bangladesh, but we have someone from WASH Plus in the room, so I don't know if they know more about that. But I haven't heard that there's been any issues, really. I think it's really working well. On these 4 areas, I was thinking yesterday when we were kind of talking about actions, I wonder if we could divide it up into actions that different actors could take fairly immediately. And when we talk about incentives, maybe talk about carrots and sticks. But I think in terms of like planning, I feel like we could all take that action fairly quickly. I mean, I don't think the WASH sector is particularly good at targeting areas with high rates of undernutrition, but this is something that we could maybe do. Same with donors. Donors have nutrition programs, they have WASH programs. They could link up a bit more closely. I think probably the planning is maybe a quick win. And then I think the evidence, is a big one. I think, what does the best type of integration look like? What is the minimum package? And I think, especially for the WASH sector, on some of these neglected issues that probably affect children far more than we've paid attention to. Great.
Okay. What's particularly struck me is what you were just saying. I mean, one big takeaway for me in engaging in this is just that the better targeting communities appropriately where nutrition is an issue. For the WASH sector, I think that's just an awareness issue that many are just not aware.
Yeah.
Okay. Well, then I ask for a round of applause. Thank you very much, Erin.